Hi everyone, my name is Dr. Abena Akomeah and I am an emergency medicine physician as well as lifestyle medicine physician. I did stick around the DC, Maryland, Virginia area after high school and decided to go to George Washington University. During my college years, I volunteered at the National Institute of Health, and it was during that time that I began to discover my interest in nutrition, metabolic diseases, and lifestyle medicine. After graduating from college, I did continue at my alma mater, George Washington, for medicine. And during that time, I had some leadership opportunities. More importantly, I served as the president of the Society of Health and Nutrition at my medical school. During my time at George Washington School of Medicine, I also began working with the admissions committee, serving as a host for students applying to medical school. During that time, I would, offer advice to the applicants. I would offer mock interviews to them, and I also would weigh in on their process. I would talk to the admissions committee about my experience hosting the medical students. So after graduating from medical school, I went on to my emergency medicine residency at Carolinas Medical Center in Charlotte, North Carolina. It's now known as Atrium Health. During that time, I continued to advise medical students who were thinking of applying to residency, as well as undergrad students who were applying to medical school. I continued to host medical students who would come to my residency program to interview, and I'll weigh in or I would give feedback to the admissions committee in regards to the students I interacted with and hosted. After finishing residency, I pursued a medical education fellowship at the University of Maryland, as well as a Master's of Education in Health Professions at Johns Hopkins University. And post-residency, I have served as the clerkship director for an emergency medicine clerkship, as well as served as the director of inclusion and equity for the emergency medicine residency program. For me, a key to success in medical school or residency is putting first things first. So putting first things first means prioritizing the things that make you you, the things that make you happy, whether that is family or significant other or religion or exercise or eating healthy. Make sure that wherever you are on your journey to medical school or residency, prioritize those things, because those things would help guarantee your wellness and your success during medical school. Once that is done, a very close second key to success in medical school or residency is making sure that you stay on top of the material. Having a daily practice of, after lectures, grab your good study buddy, someone who, who's going to help you study, and then find a way to distill the volume of information that you have just been taught into digestible nuggets that you understand, that you can relate to. I think what sets me apart would be the breadth and depth of experience I have with working with medical school applicants. I have worked with medical students, I've worked with residents, I've worked with medical students from Caribbean medical schools, and the way that I work with advisees or mentees or students is I like to empower my mentees to take the reins as much as possible as I guide them through the process. And I'm very sensitive to the fact that this could be a very highly stressful journey into medical school and as well as into residency. And I make sure that when advising, I empower and guide my advisees to create a plan that would mitigate that stress and make that whole process an enjoyable as well as a process that helps them grow. After years of working in the ER, I believe that one of my greatest strengths is I'm highly approachable. As you can tell in the ER, I see a variety of different patients, right? And a patient needs to be able to confide in their physician, especially if this is their first time meeting them, be able to confide in them so they can figure out what is going on and treat them appropriately. So I'll say that one of my greatest strengths is I'm very approachable and I'm able to connect to people very quickly, which is what I've been doing for years. I'm also one of the biggest cheerleaders in my circle, right? I enjoy seeing people succeed, people learning about themselves and overcoming obstacles. So I'm a cheerleader, I'm easy to connect with, and I'm very approachable. Important part of my career was mentorship. So in medical school, the last 2 years of medical school, I was very fortunate to find a mentor in emergency medicine, and she was very instrumental in my success today as an emergency medicine physician. I was able to shadow her working in the ER. I was able to meet up with her and discuss, my application to residency in terms of which residency programs I should apply to. She gave me advice on my essay, my application package. She interviewed me even down to how I should dress for my interview. And I would always remember how much time and effort she poured into directing me into where I am today. She has remained a guiding force since then. I've also served in the capacity of helping interview residency applicants and medical school applicants for a number of years now, and I've greatly enjoyed it. I am a product of a good advisor, a good mentor. So that's why I'm passionate, right? Because I see the difference it makes, because someone took the time to advise me when I was trying to apply to residency and where I am today. And I hope to be able to do the same for next generation of physicians, right? So there are lots of patients out there who deserve to be taking care of a doctor like you, and as an aspiring physician like you who understands them. And I believe that advising students to help them grow and achieve their goals, that continues the process, right? That student is going to become a physician who wants to make a difference in the next generation. So that's why I enjoy doing this. But I'm looking forward to working with you, helping you grow through the process, helping you present the best version of yourself to the medical school you want to go to or the residency you want to go to. Looking forward to working with you. Thank you.